Welcome, everyone. My name is Lonnie Friedman. I am the Health Literacy Specialist for Vaughan Public Libraries. I'm located at our branch, Cortellucci Vaughan Hospital. Tonight, we have a great program for you. We're going to explore living a smoke-free life with our special guest, Brianna Batondo. Before we start in earnest, though, I would like to do a quick land acknowledgement. Vaughan Public Libraries respectfully acknowledges that our libraries were built upon the territory and treaty lands of the Mississaugas of the Credit First Nation per the Toronto Purchase Agreement, or Treaty 13. We also recognize we are situated in the traditional territory of the Huron-Wendat and the Haudenosaunee, who occupied this land before the arrival of European settlers. The city of Vaughan is currently home to many First Nations, Inuit, and Métis people. We acknowledge their contributions to the life and prosperity of this land. As representatives of the people of the city of Vaughan, we are grateful to have the opportunity to work and to live in this territory. For our speaker tonight, we have, once again, Brianna Batondo. She is a part of the Central Regional Cancer Program's Prevention and Screening Team at Southlake Regional Health Center. As the coordination advisor, Brianna is responsible for overseeing all cancer prevention-related initiatives and is the smoking cessation champion for the Central region. As a registered kinesiologist, Brianna comes with an extensive clinical experience serving patients with a variety of conditions such as cancer, cardiovascular disease, and diabetes. She's highly skilled in creating patient education resources, implementing evidence-based practices, and creating community partnerships. Here is one of them. Brianna has been involved in many projects focused on promoting disease prevention through the mitigation of risk factors. Brianna is currently working on a Master's of Health Management candidate at McMaster University. So with that being said, Brianna, the floor is yours.
Perfect. Thanks, Lonnie. Quite the long introduction, and thank you for your land acknowledgement as well. So my name is Brianna Batondo, as Lonnie mentioned, and my basis is at Southlake Regional Health Center, which is located in Newmarket. And so I just briefly like to read our land acknowledgement as well. So at Southlake, where my office is situated, we recognize and acknowledge the lands that were originally used and occupied by the First Peoples of the Williams Treaty First Nations and other Indigenous peoples. And on behalf of Southlake, we would like to thank them for sharing this land. And we also want to acknowledge the Chippewas of Georgina Island First Nation as our closest First Nation community. We recognize the unique relationship the Chippewas have with the lands and waters of this territory. They are the water protectors and environmental stewards of these lands, and we join them in these responsibilities. Alrighty. So just before we get started, I wanted to take a brief moment to distinguish that throughout the course of this presentation and session, when I refer to tobacco use, I'm referring to recreational or commercial tobacco, often in the form of a cigarette. Tobacco throughout this session does not refer to the traditional or ceremonial tobacco that's used in many Indigenous communities and in spiritual practices. So we recognize and support the use of traditional tobacco for Indigenous peoples and respect the important protocols and practices that they serve, whether it's as a means of communication, to give thanks, as a connection to Creator, for ceremonial purposes and whatnot. So moving forward, I just want to set the stage that throughout this session, when I refer to tobacco, it's the commercial or recreational tobacco through the form of cigarettes or pipes or other smoked inhaled substances. All right, so throughout the course of this session, I have 4 key learning objectives that by the time we finish, I'm hopeful that you will be able to say, yes, we can check that box off. So the first one is to be able to identify the health risks associated with continued smoking. The second would be to learn simple behavior modifications to help us reduce smoking throughout our day. The third is to understand some of the differences between various nicotine replacement therapies that may be available for you or appropriate for you. And then the last is to be able to identify the variety of community resources that are available to help with one's quit journey. So first, it's important for us to at least take a step back and think about why one may choose to smoke in the first place. And maybe it's simply because you enjoy it. Maybe you find it as a stress reliever. Maybe it's a social thing where you find yourself with the same group of people. You're outside hanging out, sitting on the balcony or sitting on the porch, and you find yourself tempted because they're also smoking. Maybe you find that it helps manage your appetite or your weight. Or maybe it's a really old habit that you haven't been able to kick, or maybe you've tried before and haven't found success. So these are all very, very common reasons for people to continue to smoke tobacco. But I can assure you that stopping smoking is the single most important thing that you can do for your health. And I'll say it again, I always like to repeat the key takeaways. Smoking or stopping smoking is the single most important thing that you can do for your health. And because smoking tobacco is related to dozens of different diseases and conditions, it essentially has a negative effect on every organ of the body. There is no benefits to smoking or, physiological benefits to smoking. And it's actually the leading cause of preventable deaths in people of all ages, not just seniors, not just adults, anyone that smoke, it's a highly preventable death. So let's just quickly go through some of the health risks of continued tobacco use. And the first one a lot of people are familiar with is that smoking will cause cancer, specifically lung cancer. But one of the most common misconceptions is that smoking is only attributed to lung cancer. But in fact, smoking actually causes cancer nearly anywhere in the body. Cancer can be developed in your mouth, all the way down your digestive tract. Cancer can exist in your bladder, your colon, maybe your cervix. So there are so many different potential cancer sites that are attributed to smoking. And not only will your risk of developing cancer increase if you continue to smoke, but the effectiveness of cancer treatments actually dwindles down quite significantly if you continue to smoke after a cancer diagnosis. Continued tobacco use also could develop a variety of respiratory diseases like COPD, including emphysema, bronchitis, or if you already have asthma, it can actually make your asthma attacks quite severe and worsen. From a cardiovascular perspective, smoking severely damages our blood vessels, not just in our heart, but all over our body. So if you continue to smoke, your blood vessels could become a lot more narrow. You could have the potential for clots. And if those clots get dislodged around your body, they could end up in your heart and cause a heart attack. They could end up in your brain and cause a stroke, or they could end up, those clots can travel all the way into your vessels in your legs and cause some peripheral disease, which is very uncomfortable. So along with smoking, your heart rate and your blood pressure also remain elevated for long periods of time. So overall, smoking does have a very negative effect on our entire cardiovascular system. It also affects diabetes, or it could cause type 2 diabetes more specifically, and can make your condition significantly difficult to control or manage. From a fertility perspective, tobacco also negatively affects both male and female fertility. For females, it can make it more difficult to become pregnant. It could increase the risk of preterm delivery, ectopic pregnancies, stillbirths, low birth weights. And from a male perspective, it could negatively impact the quality of men's sperm, making a higher risk for miscarriages or birth defects as well. If you are a smoker and you've recently had a surgery, or you have an upcoming surgery, tobacco use and smoking cigarettes can negatively impact your recovery from that surgery. Essentially, smoking reduces the amount of oxygen in our body, and your surgical wounds need oxygen to heal properly. So if you're smoking, you won't have as much oxygen, and because of all the toxins that accompany cigarettes, it could lead to infection as well. In addition to that, someone's oral health can become decrease in quality quite significantly. It can affect one's teeth, one's gums. Not only that, it discolors one's teeth and could actually lead to tooth loss. For females who are past childbearing age, Tobacco use can also affect the quality of and health of one's bones. And so people that smoke, or females that smoke, tend to have much weaker and poorer quality bone health than females that have never smoked, which can lead to, a lot more bone fractures or bone breaks. Last two that we'll discuss is poor immune function. So generally, smoking causes a lot of adverse negative effects on the body. It can cause a lot of inflammation unnecessarily and can decrease your immune function and your ability to fight off infection. And then lastly, it can also negatively impact one's vision and it can impair one's vision. So your risk for cataracts can go up. So cataracts is when you have that clouding of your eye's lens, or you could be more susceptible to macular degeneration, which is damage to a small part of the retina that is vital for vision. So we see here that, again, it's not just lung cancer that you could get from smoking. It essentially can affect all over the body, and there are a lot of health risks, and not just mild health risks, significant health risks that can accompany continued tobacco use. So a lot of people say, okay, if I quit smoking, well, what's the benefit? Am I expecting all these benefits to come in 10, 20, 30 years time? Well, no, not necessarily. So what we see here in this little brief timeline is that if someone decides to quit smoking, the benefits to that decision happens almost instantaneously, where 20 minutes after someone's last cigarette, their blood pressure and their heart rate will come down to more of a normal level, which is fantastic. After about 8 hours, they find themselves being able to breathe easier. After about 24 hours, people find that their lungs are actively trying to clear out a lot of the toxins and mucus that have been lining them for so long. So after 24 hours, if you find yourself coughing a lot, that's actually a good sign. 48 hours after your last cigarette, that's when we consider you to be completely nicotine free at this point. And a lot of people report that their sense of taste and smell also start to improve by this time point. Moving on to longer distances now, after about 1 year of being smoke-free, someone's risk of heart attack is essentially cut in half. And even longer down the line, 10 to 15 years being smoke-free, one's risk of dying from lung cancer is cut in half, and someone's risk of having cardiovascular disease is the same as someone who has never smoked. So there are tons of benefits that we can see if we decide to quit smoking. So ultimately, one's decision on their smoking behaviors comes down to this: which weighs more, right? Do the reasons to smoke weigh more than the reasons not to smoke, or is it the other way around? Essentially, do the pros outweigh the cons, or do the cons outweigh the pros? So if the benefits of smoking, like it makes me feel good, it weighs heavier than the potential risk of developing cancer, then a person won't look for solutions to quit smoking. They value that it makes me feel good more than that potential cancer risk. And this is very common among a lot of smokers, because a lot of those reasons that people quit smoking that we mentioned earlier on, they provide a lot of instant gratification, whereas a lot of the risks that I just mentioned, like cancer, heart disease, diabetes, a lot of these things are further on into the future, and a lot of current smokers don't really understand or perceive that to be as big of a threat. But if a person acknowledges that the reasons not to smoke, maybe they're looking to expand their family and want to improve their fertility, for instance. If people value not smoking more than smoking, then it's grounds for a behavior change to take place. And we'll kind of go through that moving forward. So in terms of actually making a behavior change, maybe you've come to a place where you acknowledge that, like I mentioned, the reasons to quit far outweigh the reasons to continue smoking. And so now you ask yourself, now what? And it's important for us to get, before you start doing any actions, it's important for us to get a bit of a grasp on if you're in fact ready to quit. So you'll see two scales on the screen here. One is gauging one's importance and one is gauging one's confidence. And so first, we want to understand what we call your conviction level with reducing or stopping smoking. So you can ask yourself, well, how important is it for me to make this change? How important is it for me to reduce the number of cigarettes I smoke or quit smoking altogether? And you want to rate that answer on a scale from 0 to 10. So 0 being not important to me at all, I don't care very much, or 10 being this is very important to me. So if it is important to you, then you will likely be more motivated to make those behavior changes and actually work to achieve that goal. But if it's not important to you, then you likely won't follow through with the plan and actually implement the change. So when we talk about importance levels or conviction levels, ideally we want that rating from 0 to 10 to be a 7 or higher. We want you to rank this as very important, 7 to very important. If you ranked your importance level right now anywhere between 6 or less, 6 or 0, then I encourage you to try to think, how can we make this goal more important for you? Moving on to the second scale you see is that confidence. So we need to consider what our confidence levels are with achieving our goal. So ask yourself, how confident am I that I can actually make the changes that I need to be smoke-free? So again, we're going to ask ourselves on a scale from 0 to 10, how confident am I? And once you rate your confidence level, essentially, if you give yourself a score of 6 or less, I encourage you to reflect and say, well, what is it that can boost my confidence or increase my likelihood of success? Okay. And so when it comes to making these behavior changes specifically to smoking, I just want to point out that some things are very often forgotten about. And the first one is that quitting is a process. It is not a single event. And that secondly, that most smokers make several attempts to quit before they are successful for good. In fact, it's estimated that people actually take about 8 to 10 attempts before they are successful at quitting. So there are a few people, hands down, there are a small handful of people that have the ability to quit cold turkey, and kudos to them, but for majority of people, that actually is not the case. So what works for one person may not necessarily work for another. And it's important to understand that any attempt at quitting is better than no attempt. So if you have a lapse while you're working towards your goal, it's something for you to reflect on and determine why that was the case. Were you caught in a social situation where you felt pressured to smoke or obligated to smoke, or, it would have been awkward for you to decline, where your peers are smoking beside you. So essentially you want to reflect and realize, well, what caused that lapse? What brought it on, and what adjustments can you make moving forward to, if you find yourself in the same situation, to still stick to your goal and not have that lapse again. So again, often very forgotten about, but smoking, or quitting smoking rather, is a very difficult thing to do. So we don't want you to get down on yourself if you find that you reach a few roadblocks or obstacles throughout the course of your journey. So moving towards that second learning objective of identifying some behavior changes to help you quit smoking. So the first one is just to identify or, choose some smoke-free environments throughout your, daily activities or daily life, and stick to it. So you want to establish a few locations that maybe were triggers, or you found yourself often smoking in those locations. So maybe it's your car, you start with making your car smoke-free, or maybe it's your garage, or maybe it's your home. Start with one location, and as you achieve success in making that environment truly smoke-free, then you can gradually expand that boundary to make more physical spaces smoke-free for you. The second behavior change that really goes a long way is identifying your support system. So I encourage you to identify the people in your life who will be able to provide some sort of positive support as you go through this quitting journey. So it could be a friend, it could be a family member, it could be a neighbor, a healthcare provider. Maybe you're working specifically with a smoking cessation counselor. Essentially, it's valuable if you're able to share your goal to quit with individuals who share that same value, or are on the same page, or will be able to create environments that are not tempting for you to smoke. And find yourselves, or choose to socialize more frequently with individuals that are non-smokers, so that you don't feel the same type of pressure to join your friends or colleagues or peers that are smoking. And building on some of those simple behavior changes, we can look at a few very simple takeaways that you can try throughout your day-to-day life to help conquer some of your cravings for cigarettes. So we call them the 4Ds to conquer cravings. And so many people don't realize this, but cravings for cigarettes rarely last more than a few minutes. Now, to that person that is craving that cigarette, those few minutes could feel like hours or days to them. But from an actual time perspective, cravings for cigarettes usually don't last more than a few minutes. So the 4Ds, the first D we'll look at is delay. And so when you start to sense an urge to pick up and go outside for a cigarette, the first tip would be to try to delay that and wait about 5 minutes or so before you actually go. Because oftentimes if you delay that sensation and that craving, there's a high probability that that craving will actually pass on its own. The second D for the second of 4Ds to conquer craving is distract. So if you feel that sensation to go outside and have a cigarette, try to do something that will take your mind off of your desire to go out and smoke. So when you feel the craving, essentially stop what you're doing and pick up something else. Distract yourself with a person, an activity, something that you can completely switch your brain to, and be engaged in something else. That often will help minimize or kick that craving. The third D is deep breathing. And so I truly encourage people to never underestimate the power of deep breathing. It's often a trick that will help relieve stress and anxiety, which is the reason a lot of people will go to that cigarette in the first place. And so things that trigger us, we want to try to reduce. And so if you're stressed and if you're anxious and that's the reason that you often smoke, deep breathing can be a very, very valuable tool for you. So I would encourage you that if you sense a craving coming on or you're experiencing that craving, take a pause. You want to inhale through your nose and hold it for about 5 seconds. And then slowly exhale that breath over the course of 7 seconds and repeat that a few times. And it's an incredibly useful relaxation technique that can be very, very effective for cravings, but again, is often underutilized. And then that last D for conquer cravings is drinking water. So what I would encourage you to do is look to replace that unhealthy activity of smoking with a healthy one. And something as simple as drinking water can actually help to reduce cravings because it will change a lot of the sensations and tastes in your mouth that's often triggering the brain into thinking that a cigarette will satisfy those cravings. So something as simple as drinking water can actually go a long way. So a lot of people have questions about withdrawal symptoms. The side effects from quitting smoking, it definitely can be mild for some or extreme for others. There is a wide range of what people experience when they stop smoking. And ultimately it depends on how much or how addicted they were to cigarettes in the first place. Essentially, when someone stops smoking, withdrawal symptoms typically occur because the body is adjusting to not having the typical amounts of nicotine in their body that it has become accustomed to from cigarettes. So nicotine withdrawal symptoms, they can occur within a few hours of your last cigarette. They usually peak about 1 to 4 days after someone's last cigarette, but again, can last up to 6 months or so, or sometimes longer. And a lot of the times I will admit, I'm coming clean here, that they are uncomfortable and can mimic very similar symptoms of stress, because that is essentially what your body's doing. Your body is stressed because it's not having what it's become addicted to for so long. So a lot of nicotine withdrawal symptoms include headaches, tremors, difficulty concentrating, sleep disturbances, insomnia. Maybe you feel more irritable. You might find that you turn to food because you feel like you have a lot more of an appetite. Maybe you feel restless, your stomach's upset. Depression or mild instances of depression can also exist. Fatigue, or having an exceptionally low heart rate. So these are all very, very common symptoms people experience when they decide to quit smoking. But another symptom that's not listed up here, and it's not really specific to nicotine withdrawal, but I briefly mentioned earlier, is that after someone quits smoking, again, they'll have the sensation of maybe a sore throat, or will find themselves to be coughing quite frequently. And a lot of people may find that this is concerning, but in fact, it is a good sign, because that's your lungs trying to clear out the mucus and other debris that smoking cigarettes has accumulated in your lungs. So if you cough or have phlegm, that's a good sign. You definitely want to continue to expel that, but of course into a tissue. So some of you may have heard of nicotine replacement therapy before. Moving forward, I'll refer to it as NRT, just the acronym there. And in Canada, NRT is available over the counter. Most forms are available over the counter. There are a couple prescription drug forms. But essentially what NRT does is it delivers a clean form of nicotine that, is different from cigarettes. It essentially eliminates a lot of the toxic chemicals that come from smoking cigarettes, and can be a very, very helpful tool to manage those nicotine withdrawal symptoms that we just mentioned. So typically, individuals who are significantly dependent on nicotine might want to consider NRT or drug therapy to help them quit. And so what we consider to be high levels of nicotine dependence are if you smoke more than 1 pack a day, if you smoke within 5 minutes of waking up, if you smoke even when you're sick, if you wake up in the night to smoke, or you find that you keep trying to quit, you're experiencing withdrawal symptoms, and then you go pick up another cigarette. So there are many different types of NRT individuals can try, and we'll move forward and go through that next. So these are the most common NRT options that are all over the counter. So again, you don't need a prescription for. One of the most common ones is a nicotine patch. And what this one does is it essentially provides 24 hours of continuous nicotine. It's usually applied to a clean, dry area on your arm. Some people do experience some sleeping disturbances with it, so you can actually take it off during the night. But again, the patch is usually the most common selection for NRT because it's something that people slap on in the morning and then they forget about it the rest of the day. They don't have to remember to do it at time intervals or anything like that. The gum is another option, an NRT gum. It does come in different flavors and doses, but it's different than regular gum. It's not something that you like chew on and then you want to swallow large quantities of that saliva. Essentially, the technique with NRT gum is what we call chew, park. So you chew it twice and then you park it on the side of your cheek and leave it there for a bit. And what it'll do is that it will allow for a slow release of that nicotine as opposed to swallowing large quantities of it with your saliva. So you want to do about 1 or 2 pieces of gum every hour. And then the idea is that you gradually reduce the quantity of gum throughout your day. The third option that some people will choose is an NRT lozenge. So if you think of it when you have a cold, you're taking a little piece of candy that will help soothe your throat. Essentially, it's the exact same thing. You want to allow that lozenge to dissolve slowly. You don't want to suck on it and again, have that big glob of saliva swallowed. So the lozenge is another option for individuals as well. And it too does come in different flavors and doses similar to the gum. Another NRT option is an inhaler. So it's a small tube-shaped mouthpiece that's reusable. Essentially, you just put a cartridge in that contains that NRT, and it can last up to 20 minutes of continuous puffing. A lot of people do report a burning or warm or cooling sensation when they have the inhaler, but that's just a brief momentary sensation, and then it goes away after that. And then another option is a mouth spray, similar to, you know, a breath freshener or whatnot. It looks the exact same. It's small, it's portable, and it delivers that same nicotine therapy or replacement therapy through a mist that's directly sprayed into your mouth. What's nice about it is that it's quickly absorbed. You're not parking it or, you know, in your mouth for long periods of time. And essentially it's a small dose every time you use it. So again, these are very, very different options. Some work better than others. Most people, you know, most NRTs can be used, most of them are for about 8 to 12 weeks if it's properly used, but NRT can be used for upwards to a year. I will say that many individuals typically report that they don't respond well to NRT, but I can almost guarantee that majority of the times it's because that they're not using the NRT properly. So there are instructions similar to the gum and the lozenge, right? It's not used like your typical gum and lozenge, and there are techniques for it so that you don't, or to minimize the amount of side effects that come with using it. So again, NRT, they do have mild side effects, but a lot of these side effects absolutely pale in comparison to the side effects or withdrawal symptoms from NRT that we mentioned earlier. So you kind of want to pick your battle. Yeah, you might have some sensations and some symptoms or side effects from this NRT, but they're definitely nowhere as near as severe as the nicotine withdrawal symptoms that we mentioned earlier. All right, and just moving through some of those community supports. So if you have decided that you are ready to quit smoking, it's important to be aware of what type of supports there are in the community that can help you along the way when we refer to it, you know, throughout your quit journey. So the first individual I would often encourage people to speak to is their primary care provider, their family physician, for assistance with quitting smoking. So they'll often be able to support you perhaps with that prescription form of NRT, either separately. Some people just have the prescription NRT, or they use it in combination with the NRT over-the-counter options that we just went through. So your family doctor, primary care provider would be an excellent first step, especially because they can take a look at, you know, if you're taking any other medications, they'll take a look and make sure that your dosage of NRT is appropriate and compatible with some of the current medications that you might be on for other medical conditions. You can also seek out smoking cessation counseling from a new provincial support program that's called Health Connect Ontario. So you can access it online if you go to Google and just type in Health Connect Ontario, or you can actually pick up the phone and call 811 to speak with someone as part of the service. And this is a fantastic option because it also offers a free and confidential support for quitting smoking, vaping, or any other form of tobacco use. You'll have a care coordinator that connects with you. It's offered in, I believe, over 100 different languages. You can access it by phone or by text. And essentially, you'll have regularly scheduled counseling check-ins with a care coach at times that are most convenient for you. If your primary care provider is part of a family health team, or you receive care, you're a patient at a nurse practitioner-led clinic, you could be eligible for up to 26 weeks of free NRT, the over-the-counter type of NRT, and counseling. So I would encourage you to, you know, check in with your family doctor or your nurse practitioner to see if that is something that is available in their practices. Looking at the bottom row, so if you identify as First Nations, Inuit, Métis, or Urban Indigenous, Chalk Tobacco actually might be a suitable program for you. It's very similar to the Health Connect Ontario, where you'll be connected with a care coach. It's free, it's confidential. The information though and support provided is culturally sensitive. So it takes into account the different relationship that tobacco user or that Indigenous populations, many Indigenous populations and communities have with traditional or ceremonial tobacco, and will just provide culturally sensitive support. So it's offered, I believe, in 24 Indigenous languages and can be accessed by phone, online chat, or text as well. In addition to everything that's already been mentioned, some local pharmacies that are participating in what's called the Ontario Smoking Cessation Pharmacy Program. And what that means is that they actually have qualified pharmacists available to provide on-site smoking cessation support. So if you are an Ontario drug benefit recipient, you can enroll in their smoking support program at no fee. So I just want to caution though that it's important to know that not every community pharmacy offers this service. So before you go to that pharmacy that might be closest to you or one that you've gone to before, I would just encourage you to give them a call ahead of time, just to ask if they are part of that program or if they have a pharmacist that is qualified in providing smoking cessation support. And lastly is the Center for Addiction and Mental Health, or what we often refer to as CAMH. They have a free virtual smoking cessation program that's called Stop on the Net, and that offers the opportunity for free nicotine replacement therapy access as well, and counseling. So we see here, based on the variety of community supports that I just mentioned, that the task to quitting smoking or smoking cessation is not one that needs to be taken alone. And oftentimes it is extremely difficult to take it alone. So there are ample community supports that are available to help you with your quit journey, whether it be with NRT products or with counseling. Essentially, we want to find a support system that will set you up for the best chances of long-term, sustainable, smoke-free success. So just to kind of recap on the learning objectives that I stated at the beginning of the session. So again, the first one, we wanted to identify the health risks associated with continued smoking. So we talked about cancer, cardiovascular disease, fertility, bone health. We talked about quite a few. The second one was to learn simple behavior modifications to help with reducing smoking. So again, we talked a little bit about finding that support system, making or establishing those smoke-free environments, and then those 4 Ds to conquer cravings. We talked a lot about the different nicotine replacement therapies like the patch, gum, lozenge, inhaler, mouth spray. And then we briefly just touched on the community resources that might be available to help you with your quit journey. So I would really encourage you to, try multiple. Again, it takes many attempts to actually find success with quitting smoking. So don't be discouraged, or try as best as you can not to be discouraged if your first option or second option or third option isn't really what's working for you. A lot of people try a lot of different things before they are truly able to be smoke-free. And so I'll wrap it up there. But as Lonnie mentioned, I can definitely field some questions if anyone has any questions.
Yeah, thank you so much for the presentation. That was excellent. This affects me personally. My father, he was born in 1944. He smoked since he was a teenager for 55 years. He developed, of course, COPD. He finally quit after trying many times when he had to go to the hospital about a decade ago because he couldn't breathe. He couldn't just catch his breath, and he was there for a couple of weeks. So those 2 weeks are the 2 weeks he didn't smoke. And I think it was finally a wake-up call of, if you don't stop doing it now, it could be dire. So yes,
Sure.
if he had tried these interventions, I think it would have helped a lot. So again, thank you for exploring those and letting us know. So for those who are here, you can put in the chat again if you have any specific questions. I'll share Brianna's information with those that I emailed the link, or feel free to write it down as you see it on the screen. So we'll wait a minute to let people, or you can unmute yourself if you're comfortable doing that. Either one, put a question in the chat or unmute yourself. We'll wait a couple moments. Let's see here. Yeah, Brianna, how many people would you estimate broadly that like come to your hospital or just in general trying to quit?
Quite a bit. And, specifically where I'm working, a lot of cancer patients. And again, a lot of the conversations that are I don't have a percentage off the top of my head, but I would say a considerable amount. And a lot of people, for various reasons, are not ready to quit. Even, there are a handful of people that receive their cancer diagnosis, and that's kind of what you mentioned, a wake-up call. So there are a few of those people, but I would say, a lot of people still continue to smoke after their cancer diagnosis because that's a stress or coping mechanism for them. And a lot of people don't realize how much it's negatively affecting their treatment. So, maybe their treatment's not working as well as it could, and that means that they need to have more treatment in the future. And so ultimately it comes down to, supporting that individual and making sure that the resources available to them, it's not overwhelming, because after cancer diagnosis, it's very overwhelming. But we kind of want to be persistent in offering that support, because there are a lot of individuals who are cancer patients and are still continuing to smoke. It's just a habit that they are not ready, or find that they don't have the support to be successful, so they just continue smoking.
Yeah, it is interesting to think about those two, because almost all of the symptoms you talked about, the long-term symptoms, my father has experienced heart disease of various sources, or his mouth is just a mess. He's always in pain as a result. This is after quitting. And so the earlier you quit, of course, the better it is. I think the key thing too is when he got home, he never was able to go out. Like he used to go shopping, for example, and that's when he would buy cigarettes. So everything changed where my mother would go shopping, and we just took all the cigarettes that were at home and we threw them out. And so that support system there that you were talking about, but in a different format where we were able to control sort of what he could take in, as you're saying, the wake up call. That's a fairly extreme scenario that I just, but
no, but it happens. It happens on mild circumstances as well as extreme situations. I mean, there's no doubt, we don't want to discredit that it's an addiction. It's something that people really struggle with. And there's no shame. We don't want it to be a shameful experience when we offer support. We know the benefits, and we want you to see the benefits as well. And know that it's not just because it's an old habit and you've been doing it for 50 years doesn't mean that it's too late. It's never too late to quit smoking.
Absolutely. Yes. We have one comment says, just like to thank you for the presentation. So once again, Brianna, thanks. So one last chance. Does anyone want to ask a question? Otherwise, I'll share Brianna's email here in the email for the link. And one last chance. Okay. Well, thank you, everyone. Thank you, Brianna, of course. This was an excellent presentation. And I hope this, for some of you, will spark to start really considering, if you haven't already, that it is possible. And in the case of my father, after 55 plus years, it can happen. And he's much better off as a result. And so are we, because we don't have to, secondhand smoke in the house or what have you.
Exactly. So it affects a lot of people, not just the person that's smoking. So it's definitely a team decision or a team impact if someone does decide to quit.
Absolutely. Great. Okay. Thank you, everyone.